Hello, everybody. Thank you for joining our second webinar about shockwave therapy. I fixed all the PC issues I had for the first time, so all videos are running and all slides are in perfect speed. So I would say we just start right now. We're talking about some theory things first. You will see some case reports, and at the end we have got time for questions and answers. So feel free to use the chat button of the free answer button below. Just share the screen. So let's start with our shockwave therapy lecture webinar. My name is Alexander Ablas. I'm a physiotherapist from Germany. I'm working with a shockwave device since 8 years now. I'm in charge for First League soccer team and ice hockey team in Augsburg and have my own clinic. We need to talk about the theory first. What are our aims of modern shockwave therapy? We need no or less medication. We need no or less injections, for example, cortisone. We can avoid surgeries. It's non-invasive and has got a low risk level and a high effectiveness in our treatment. At the end of the day, we have happy patients and, of course, a successful clinic. What is the science behind all this? Before we come into detail, I need to introduce Professor Schmitz, because this guy made all the research we have so fast within the last 15 years. So a lot of studies I will mention and show you during the lecture are done by him. Short information about the Petro database, because it's a quite important database. In this database, you can find more than 54,000 randomized controlled trials about shockwave therapy. There are most of them done with the EMS device. And the important conclusions about the Petro database, if you make an analysis about all the shockwave RCTs which can be found in there. First, there is no general advantage for focused or radial shockwave therapy. It is wrong to say focused shockwave is a kind of high energy and radial low energy shockwave. And 75% of these RCTs listed in the Petro database are done with the Swiss dollar class device. About the differences between radial and focused, we come during the science part of my lecture. What is the technology behind all this? As you can see on the pictures and the question, what are shock waves? You can see a shock wave is an acoustic wave. It's a sonic pulse that has certain physical characteristics. As you can see on this picture, we need a high pressure in the very beginning of our wave, up to 100 megapascal of pressure in a very short period of time. We call this compression phase. After this compression phase, we get a negative phase of pressure, which we call tensile phase, which is approximately 1/10 of the maximum pressure we put in the tissue. So how does energy transmission and restitution work? The stimulation of the tissue by a single shock wave starts with a primary compression phase, followed by the negative pressure phase called tensile phase. The tensile phase releases the energy from the compression phase into the tissue. One of the effects of energy restitution is the generation of cavitation. So a high cavitation level is a result of a high amount of energy density delivered by this shockwave device. Let's talk about radial shockwave first. Radial shockwaves are generated by compressed air, which is reaching the piston, accelerating a projectile up to a speed of 90 kilometers per hour. This kinetic energy is converted into the acoustic pressure wave, which then entering the tissue. So, as a short repetition, what you just heard, first, we have the positive energy density, the compression phase, which you can see in the top picture. Then we've got the negative energy density. We call it tensile phase. In this phase, cavitation bubbles start to appear, which you can see in the second picture. You also can see in this video how one single radial shock wave actually appears. Let's come to the focused shock wave. The generation of the focused shock wave is completely different. The focused shock wave of the Swiss piezo class is generated by piezoelectric crystals. So we have got a voltage supply which is going to the handpiece. Inside the handpiece, we have 1000 piezoelectric crystals, which start vibrating and then causing the wave. Everybody of you knows these piezoelectric crystals. They can be found also in every mobile phone, causing the vibration. You see the penetration is going up to 8 centimeters deep. So these are the characteristics. We have got the positive energy density, compression phase again, which looks in the focus device completely different. We've got the tensile phase, the negative phase, to generate the cavitation bubbles. You can see here. And also here, a video about the generation of a focused shock wave. This study tells us that the significant part of shock waves, the effect, what we can generate in the tissue is mediated by cavitation. And cavitation is consequent to the negative phase, the tensile phase. In this picture, you can see the appearance of a cavitation bubble in correlation to our shock wave. You can see that the cavitation bubble gets its biggest diameter in the negative phase. That's where they start to appear. When the cavitation bubble gets hit by the next following wave, we get a so-called jet stream and we get the burst of the previous cavitation bubble. When we talk about cavitation, we need to talk about different handpieces which can be found on the market to compare the amount of cavitation, because we need cavitation to generate effects in the tissue. In the left picture, you can see different kind of handpieces and the cavitation bubbles generated by them. You can see slightly cavitation bubbles at the BTL device and at the Storz device. And then depending on the different handpieces of EMS, you can see this is a former radial device. This is the common Evo Blue we can find, and this is the focus device, the piezo class. And you can see a high amount of black areas, which are cavitation bubbles. But we don't know the total amount of cavitation bubbles because there are more black dots lying over each other. So we need to count these cavitation bubbles to find out how many do we actually have. This is what we see on the right side. So Also, we have got 4-bar pressure input, and at a 15 hertz frequency, you can see the difference between all these different kind of handpieces. The conclusion of this is that the air pressure of radio shockwave devices does not predict the energy outcome of these devices to the patient. So also it's the same setting with these devices. You can see that the Evo Blue handpiece and the piezo focus device deliver the most energy into the tissue. A very important study was done almost 1 year ago in Germany at the University of Aachen. This has been a very independent study. They just asked two radio shockwave device producers to send them a device to make a comparison about the energy delivery. So the first device, of course, was the EMS radio shockwave device from EMS. What you can see in this graph is that we have got the frequency, we have got the energy delivery, and we have different bar pressure input settings into the handpiece. And what you can see is that the EMS device can maintain almost the same energy density which is delivered to the tissue at all frequencies. The maximum energy loss of the Dollar class radio shockwave reaches 18% at the maximum output and frequency levels. The second device was the Storz Masterpulse 200 Ultra. If we compare this, you can see the pressure input in the piston is at a maximum of 5 bar possible with the Storz device. So we have got 5 lines in total. But what you can see is by increasing frequency, the Storz device loses almost 92% at the maximum setting and frequency levels. If we now look into the literature, Petro database and the literature in general, 90% of the studies done with a Dollar class radio shockwave device and published in the database use an energy flux density of 0.1 millijoule per square millimeters. With this energy flux density, clinical outcomes are demonstrated with the Dollar class and can't be claimed by another device using the same settings. So, to make it clear and putting the lines over each other, the red line here is the minimum energy delivery, what we need and which can be found in the literature. So this energy delivery is necessary in the tissue to get the effects which are listed in these RCTs. So the conclusion is that the Storz device is not possible to reach the minimum amount of energy flux density in the tissue, which actually is needed to generate the published effects in the tissue. The second very important conclusion is the high energetic radio shockwave, what you saw first, EMS device, in comparison to low energetic radio shockwaves, is leading to better results. Now, to suggest if I have a low energetic radio shockwave, I just double the amount of impulses to get the same energy in the tissue, shows point number 2, which is shown clearly in this study. The lower energy outcome cannot be compensated by increasing the impulses. Every single shot counts, and every single shot needs to be with high intensity. I've got 2 pictures to show you the cavitation. You will see 2 different devices in comparison with an EMS device. Settings almost the same. Storz and BTL even a bit stronger with the pressure because they have 5 bar. We put the handpieces into water. The handpiece with 3 blue rings is the EMS device, and then you can see cavitation in water, and you will see the difference. So on the right side is EMS on the right side. On the left side, there is EMS on the left side. And you can clearly see the difference of cavitation bubbles, what can be found in the water. And we have the same thing with the focus devices. This is a study which is almost 10 years old. So to make the comparison between the Swiss piezo class and the Stolz duolith, you see in the left picture, which is the EMS device, that we reach a maximum pressure income from over 110 megapascal pressure, and we have got a negative phase of pressure from about -20 megapascal. Whereas the Stolz duolith just reaches short about 40 megapascal of pressure in the compression phase and less than -10 megapascal in the tensile phase. So you know, and for this, you have the result why we have got a lot of more cavitation in this area, which actually is needed to get the results in the tissue, whereas here, it's a lot less. So the differences between radial and focus, just to make it very clear and simple for you, is the maximum energy output from the radial is 0.28 millijoule per square millimeter, whereas the piezo reaches 0.55 millijoule. So a lot more energy can be delivered to the tissue. The penetration is different. The radial device reaches 0 to 4 centimeters, and the focal device is going up to 8 centimeters deep in the tissue. The radial shockwave is the most versatile device. It's very good for superficial applications. 90% of all tendons are located less than 50 millimeter under the skin. We can treat a larger surface, so large muscles and muscle chains. And it's a faster treatment, up to 3 times faster than a focus device. Why choose the focus device then? This is perfect for deep applications, for high energy applications. For example, non-unions, bone healings, this stuff. We can precise targets, so directly going on fractured areas, we can deliver high energy to very small areas. And it's good for hypersensitive patients. What are the effects of shockwave therapy? First of all, of course, pain relief and pain elimination. This is what our patients feel the most immediately during the treatment. Increase of blood circulation in the entire surrounding tissue. So during a treatment, sometimes you can see that the skin is turning into a slightly red. Then one of the most important things, inhibition of inflammation. We come to this later, again, more closely. Activation of reparative processes in the tissue. And of course, a muscle relaxing effect. Let's talk about inflammation, neurogenic inflammation, and about pain. As you can see, we're talking about a circle, which means substance P and pain and the neurogenic inflammation is a self-stimulating mechanism. So substance P, which can be found in the tissue, in the pain receptors, increases the sensitivity of C nerve fibers, leading to an increase of this nociceptive signaling. Because of this, the nociceptive stimuli trigger a protective response and releasing more substance P by the C nerve fibers. This substance P stimulates the activation of mast cells and leading to a release of histamine and vasodilatation. So the inflammation. And this is causing, again, an increased sensitivity of C nerve fibers and leading again to an even more increase of nociceptive signaling. So this is the pain circle. The neurogenic inflammation, as I said, is a self-stimulating mechanism that block healing process and the expression of scleraxis. So in every injured tissue, we find neurogenic inflammation. And this neurogenic inflammation needs to be depressed or needs to be blocked to get a proper healing. Scleraxis is a transcription factor, which is required for the development of tendons. So it can be found in every phase of tendon repair. In every differentiated tendon cell, we can find scleraxis. So shock waves inhibit the release of substance P and blocking the neurogenic inflammation. There's also a kind of drug-induced inhibition, like local anesthetics, they inhibit healing, and corticoids inhibit healing too. Local anesthetics and corticoid injections are symptomatic treatments. None of them inhibits the release of substance P, and none of them suppresses the neurogenic inflammation. What I prefer, or what I like to explain it to my patients in my clinic is, I show them a picture of this, a red hot chili pepper. Why is that? Red chili pepper contains capsaicin, which is causing a pain feeling in the mouth. After a certain amount of time, it's getting numb. And this is basically what we can produce by using a shockwave or pressure wave device. So with the chili, first it burns, then it goes numb. With the shockwave, we have got pain first, and then we have got recovery. So as you can see, we need pain. So one of the most important things providing shockwave therapy is we need a proper pain feeling. The patient needs to feel pain. 6, 7 out of 10. This is the patient's pain threshold. So as a short repetition, as we have less substance P, pain is going down. If you have less substance P, the neurogenic inflammation is going down. If the neurogenic inflammation is going down, then we get the release of growth factors, activation of stem cells in the treated tissue, and an increase of scleraxis genetic expression, what we basically need for proper healing. Just another short information about scleraxis. Cortisone, painkillers, local anesthesia is decreasing scleraxis. Shockwave is increasing scleraxis. So, by increased release of substance P, we get analgesia, reduction of neurogenic inflammation, increased blood flow. Then, release of growth factors and activation of stem cells, activation of cellular defense, activation of the body's own repair mechanisms, inhibition of coenzyme COX-2, antiphlogistic effect, and the vibration in the tissue can lead to a muscle relaxation. What are the indications for shockwave therapy? I try to make an overview about the classics, the company's approved indications, the well-known indications, then other approved indications, off-label use, trigger points, and more. So what are the classics, the most common and well-known ones? Of course, Achilles tendinopathies, tennis elbow, heel spur, calcifying shoulder, enthesiopathies, tendinopathies of the patella tendon. I think everybody knows these. The approved indications for the Donoclast device are, for example, the calcifying shoulder, medial tibial stress syndrome, Schlatter disease, trochanteric pain syndrome, plantar fasciitis, wound management, Achilles tendinopathies, and many more. If we have an a view on the modern indications and the off-label use, so things I'm using in my clinic almost every day, you will see there are many, many, many more things. So all kind of muscle injuries. I don't care if it's muscle strain or fiber rupture or bundle tear, osteoarthritis, chronic polyarthritis, acute and chronic cervical spine syndromes, um, acute and chronic spinal cord syndrome, acute and chronic lumbar spine syndrome, so classic low back pain, sacroiliitis, fractures and pseudarthrosis, bone bruises and bone marrow edemas, osteochondrosis dissecans, tension headache, migraine, lymphedema, Tructus syndrome, Schlatter disease, Seaver disease, and many, many more. Trigger points. Why trigger points? Because trigger points making the bridge between neurogenic inflammation, substance P, and another very important indication. By treating trigger points, we can get so many effects in the whole body. So we know that trigger points appear and are caused because of musculoskeletal dysfunctions in the tissue, like a muscle overload, which is causing these trigger points. Even more interesting is if you have a closer look in the biochemical milieu of a trigger point. So what can be found inside of a trigger point? Selected inflammatory mediators, neuropeptides, cytokines, and catecholamines, which means basically we find the same mediators, inflammatory mediators, so as substance P, which is basically causing the pain in these trigger points. So this is a perfect use using the device to shut down the neurogenic inflammation in these kind of trigger points to get an immediate release. Local anesthesia. Never use local anesthesia together with radio shockwave. Why is that? By injection of local anesthesia, I'm changing the patient's pain threshold. I told you before, it is very important that the patient needs to feel pain during the treatment. So if I use local anesthesia, I shut down all these pain receptors in the treated area, and the patient is not feeling any pain. Without feeling any pain, I don't get the release of substance P, the overwhelming of these pain receptors, and I get no proper effect. This is how a trigger point treatment can basically look like. So we can use the shockwave alone. We can use a laser before using the shockwave. I prefer doing a cooling device afterwards because it's increasing the effect of shockwaves. Never use cooling devices before, otherwise you get the same effect as using local anesthesia in the area. And as a homework, these trigger things can help the patient doing exercises at home on persisting trigger points. Let's talk about other approved possible indications if we have a close look in the literature and about studies which have been done. We know shockwave therapy activates lubricin genetic expression. What is lubricin? Lubricin can be found around every tendon. It's like the engine oil of our tendons. So to increase this engine oil around our tendons, shockwave can be used in a perfect way. Everybody of you knows that patients after wearing a walker for 4 to 6 weeks, for example, can't move their ankles proper after the walker gets removed. So using shockwave therapy can induce the tendon gliding and making the mobility of the ankle, for example, much more quick. Shockwave therapy can improve blood supply. One way we already mentioned, it's that we see a slight red turning in the muscle tissue, in the skin tissue, but it goes one step further. We can accelerate wound healing. associated with increased density of newly formed capillaries in the tissue. This is, of course, an effect which definitely takes a bit longer. So, according to therapy of erectile dysfunction, it's not done after 3 to 4 treatments. This is something which definitely takes more time because we need newly formed capillaries. Then one of my favorites, as you will see in the cases, shockwave stimulates new bone formation. So we know with these energy flux densities, we can generate new bone formation. And even in osteoporosis is a possible clinical indication. We have got an acoustic wave. Don't forget this. It's an acoustic wave. We don't do anything mechanical. So you don't have to worry that we have an increased fracture risk during shockwave. And in our daily clinical life, we don't stop doing shockwave after 4 to 6 weeks after the bone regeneration or primary healing. We know that the proliferation and differentiation of osteoblasts in the bone is going on after 6 weeks and after 8 weeks. So we try to increase the treating time and do every 2 to 3 weeks another treatment to increase the proliferation and make the bone even more hard. Osteoarthritis of the knee. This study just shows, yes, we can effectively treat all these things. Pain reduction, function, everything is in comparison, of course, in comparison to another treatment, more effective. ACL reconstruction, radio shockwave after ACL reconstruction. So starting immediately and having a look at the 2-year follow-up after an ACL reconstruction, we can see that patients who received the radio shockwave therapy during the rehabilitation are more improved in function and pain. About patellar tendinopathy, focused or radial, I just mentioned this again because we had the overview. Yeah, there's no significant difference in the effectiveness between these two. We can treat superficial things like tendons with both devices. So it's a recommended treatment to use the shockwave devices on these patellar tendinopathies. There's no gender difference, which is quite important. We have a lot of discussions in professional sports by now about treating women and men different because most of these patients in professional sports are male. So this is a study that even patellar tendinopathies, there's no difference between male and female. Yeah. Tendon healing after rotator cuff repair. Shockwave therapy in combination with exercises is more effective than rehabilitation alone. Osteochondritis of the talus. To make it simple, also there it is more effective. With these chondritis, osteoarthritis, whenever itis is in the word, we have this certain inflammation, neurogenic inflammation in the tissue. So we can induce the healing earlier to limit or get the neurogenic inflammation out of the tissue. Shoulder impingement syndrome. Shockwave therapy versus cortisone injection. This is a quite interesting thing. If we have a close look at this study, you can see that in the first 5 to 7 days, cortisone injection is better than shockwave therapy. But this is very clear because cortisone injection releases the pain immediately, almost immediately after the injection. Shockwave therapy needs some more time to get started. So the first 5 to 7 days, cortisol seems to be better than shockwave therapy. But in a long-term view, after 10 days up to 6 weeks, we can see clearly that radio shockwave therapy is leading and is more efficient than the cortisone injection. Frozen shoulder. Compared to the control group, you could see significant clinical and statistical improvements in all outcome measures, so as pain, range of motion, etc. Tenosynovitis of the long biceps tendon. Both groups showed good recovery, therefore, the radial shockwave trial was in a long-term effect better. Osteochondral lesions. Using hyaluronic acid and shockwave is safe, of course, and more effective than hyaluronic acid alone in the treatment of these osteochondral lesions. When we talk about so many nice indications using shockwave, we definitely need to talk about contraindications. You can see the list of the company's contraindications listed in the handbook, but I want to explain these contraindications. Yeah, treatment over air-filled tissue, such as lungs or intestines. The gut, intestines, there is nothing which needs to be treated. So the abdominal region is no area for us to treat. Lungs, we don't need to treat the lungs. So we need to make sure if we treat the back that we don't go as deep to reach the lung. How can we see with a radio device when we reach lung? Basically, our patients, the lung itself has no pain receptors. So it's the skin over the lung which is actually causing the pain feeling. But before we can cause pain feeling on lung tissue or the skin over the lung, our patients start to cough by irritation of the lung or the phrenical nerve. So whenever our patients start to cough during upper spine treatments, we just change the position, go to another spot, because we don't want to force this coughing feeling. I wouldn't suggest using the focal device on upper back treatments because it's more a treatment of larger areas. So we concentrate in this case on radial treatments. Treatment of torn tendons, if more than 50% are injured, of course, then we need to have a closer look in the MRI or making an ultrasound afterwards. Treatment of pregnant women. Of course, we will never treat pregnant women in the lower back and in the area where the baby is. Treatment of persons under the age of 18, except the mobile Schlatter disease. The reason for this contraindication by the company is that we need to avoid shooting in the growing zones of children. The Schlatter disease, tuberositas at the tibial bone, is not an epiphysis, so it's not a growing zone, it's an apophysis. And then think of other apophyses to get more indications, like the Seber disease on the heel or in the iliac bone, for example. Yeah, so we try to avoid growing zones, but when I have patients under the age of 18 suffering from a muscle injury, which is not affecting the growing zone, then of course can do shockwave therapy. It's just a kind of off-label use. Treatment of patients with blood coagulation disorders, like, for example, also including local thrombosis. Of course, I don't do shockwave in this area because I need to be careful that I don't get an effect with the thrombosis. Treatment of patients treated with oral anticoagulants. I think this is a very important topic. We need to talk with the doctor if a shockwave therapy is really important. Make call with the doctor and ask if it is possible to make a break with these medics for 1 week, for example, and doing a treatment. So this is a possible way to do the shockwave also. Then treatment of tissues with local tumors or local bacterial and viral infections, of course, that's a contraindication. And treatment of patients who have been treated with cortisone. So cortisone is a cell poison, we know this. So if we have a local cortisone injection at the tendon, for example, we need to wait at least 6 weeks. I prefer waiting 8 weeks until using the shockwave in this area again. If we talk about a joint injection of cortisone, I don't have a problem treating the tendon. So it's in the capsule, it's inside the joint and not around the tendon. Using cortisone as a pill, I'm not concerned about doing shockwave there because it's a systemic use of cortisone. So we talked about a lot of important things now, theory and all this stuff. Now we come to some cases. Before I start these cases, my cases you will see now are not protocols for every patient. It's just an example, the way I treated my patient, this very patient with this very indication. So to give you a rough protocol about how to start a treatment and how I do the settings, basic settings, I propose using 20 to 25 Hertz frequency, because we know as much energy in the tissue to get good effects and good results. And we know the EMS device is providing almost the same energy delivery at all these frequencies. Then we are applying 3,000 to 5,000 impulses. Basically, we're using the shockwave as long as we can produce or see a positive result like pain relief, muscle relaxation at the end of the treatment, or more range of mobility, for example. How often do we treat? Every 5 to 7 days. And for most indications, 3 to 5 treatments in total are enough. How much bar pressure do I put into the handpiece? I mentioned this before, 6, 7 out of 10, until we reach the individual patient's pain threshold. So let's start with the cases. I try to make an overview about the different kinds of indications. So let's talk about muscle injuries first. This study on the left side has been done by one of the professional sports physios in Germany. He was treating all muscle injuries within 1 season at the club with a radial device. Special setting, which can be found in the study. So when you just have a look later on the video again, in these QR codes, you are leaded directly to the study. What they found out is that the layoff time could be reduced between 23 and up to 54% in comparison to a FIFA study, which has been done. On the right side, you see a muscle injury of one of my professional athletes. And what you can see in these pictures is progress within 10 days. So you can see the enormous reduction of fluid inside the muscle. This was my first player suffering from a biceps femoris bundle tear. So my first experience basically using the shockwave, and that's why this case is always in my lecture. So a sudden pain attack during a sprint in the back of his thigh, big hamstring rupture in the biceps femoris muscle, very big as you can see in these pictures, a lot of fluid inside the muscle. So something to start immediately with shockwave. First treatment price on the pitch or on the way back or in the club with cool compression therapy devices, and then immediate start within 24 hours. So this was 24 hours after the injury. We try to start even 12 hours after the injury. 2 bar pressure in the beginning, according to his pain threshold. We continued the treatment for 14 days. In this case, we did it daily because we had a device in the club. But remember the protocol I told you before. Yeah, once a week for our normal clients, perfect. These patients are in a very quick manner, they are pain-free. Yeah, not just in rest, but also in normal walking, which is quite important. Yeah, so quick pain relief. I don't need pain medications, and my clients or my patients don't ask for pain medications. Cycling is possible after 7 days, running after 13, and then from day 25, he is restored to join the team training, and after 35 days, he is able to play 90 minutes a first league match. We start treating this area every 4 to 6 weeks, just as a kind of prevention. But this player is not suffering from any muscle injury within the last 6 years. Prevention, I've just mentioned prevention, which is even more important using the device as a prevention tool to avoid these muscle injuries. What we made is we checked the last years, 2014, 15, and the beginning of 16, how many severe type 3A to 4 muscle injuries we had in the 4 top youth teams of our youth academy. So 100 players, and you can see a high amount of really severe muscle injuries. So in May 2016, we started using the device as a prevention tool. So whenever the player was cramping, got hit or kicked, felt the muscle a bit stiff, we immediately start using the device. And what you can see is in a very quick way, second half of 2016, 2017, and 2018, you can see an enormous decrease of these severe muscle injuries. The red one is a quite important one. That's why I left it. This was a complete muscle rupture during rehab. Problem was that during the rehab, the compliance of the player was bad. So he never issued any problems during the treatment and the rehab process to bring him back to team training. So we can use the best device, yeah, to reduce it, but we need the compliance of our patients. We need feedback. So we need the feedback of the individual pain threshold and also in the rehab process. Fractures. I told you before, it's one of my favorite topics. So what you can see, it's an under 19th national team player, Jones fracture. Got a surgery with screw osteosynthesis, which I really prefer because using a screw for this kind of injuries, I can reach with my shockwave device the fractured area around the bone from every direction, whereas a metal plate is limiting the effect of the shockwave because the wave itself is not penetrating the metal plate. So I need to find different ways to reach the fractured area. So, first day in hospital, cooling device, lymphatic drainage, business as usual, I would say. Then we tried to start already on the second day with radial shockwave for lymphatic drainage, for reduced swelling and pain relief. By increasing during the next treatments, we can decrease the diameter to the 15 millimeter applicator to get even more energy in a smaller area. After 4 weeks in the control X-ray, we can see that the healing in this area already started, which is quite important to avoid pseudarthrosis or delayed bone healing. So he's walking, still wearing an air walker, but to go on the bike without air walker and a normal shoe, cycling is possible. After 6 weeks, the next control X-ray, you see that the healing is almost completed. So we can increase the load, start training with the ball, increase running, and have at least back to the team training in 11 weeks and making his first season game after 13 weeks. So about all these Jones fractures, these really bad healing areas, we have got the fastest one within 5 weeks back on the pitch and up to 12 weeks on the pitch. And as I mentioned before about bone healing, for the next 6 months, once a week to get an optimal result and make the refracture rate as low as possible. Fracture of the left metacarpus, you see also early beginning after the surgery. More complex trauma. A good friend of mine was 8 years ago, he was one of my players. Now he's a trainer, and during a normal training exercise, this accident basically happened. He had an ankle distortion trauma with severe fracture in the tibia, fracture in the fibula bone, rear and front syndesmosis rupture. So it's a real severe injury. 5 days after surgery, he came to my clinic for treatment. This was basically what the ankle looked like. 2 more days later, so 2 days after the first treatment, he came back for second treatment. And this was what the ankle basically looked like, or the foot looked like. Another 3 days later, it looked like this. So you can imagine that after a severe trauma, and severe surgery, like you saw just in the pictures, these legs, this ankle has almost no pain, no swelling. So you have no pressure on this area where it basically needs to heal. We have got no inflammation, and the healing process starts very, very early. Just 2 important studies about non-unions and delayed bone healing. We know even non-unions, we just don't only need the focal device because of the highest energy in this area. We also know that of superficial bones, the radial device is perfect working. The conclusion is, yes, for non-unions, shockwave therapy is a good working thing. As a case, this is just delayed fracture healing. This was a planned surgery of femur correction after 6 weeks. You see, it's not proper healed. So we started 5 combined shockwave treatments, so radial and focal. And you can see in less than 4 weeks already, the healing process finally starts properly, more colors. You also can see in between the cortical bone starts to heal. Continue the treatment, doing another 5 combined treatments, and then finally you can see that this is a good healing bone. If it's a rheumatic arthrosis like this, yeah, almost the same injury like Felix, the friend, had before in the ankle. So the fibular bone of this guy was not healing. So after 8 months after the surgery, he came to my clinic asking for shockwave therapy to get this fibular bone healed. And the result, 10 treatments within 4 months, you see a fully healed fibular bone, combined, of course, focus and radial. Inflammation of the pubic bone. These are the pictures we did before starting with the shockwave, just to make sure that how the situation in this area is, because he was suffering already for more than 7 weeks with these kind of problems. So we started immediately after the MRI with the shockwave treatment. First treatment was very low, 1.3 bar, very painful. We had to increase it every 3 days, needed more shockwave on the pubic bone, the abductors, and the entire back. And this was the result 6 weeks after the first MRI. And already 10 days before, he was playing 90 minutes of tennis, was entirely pain-free. And the last shockwave we did was at 3.6 bar. Important for these cases and also the Schlatter disease of children. Never give these players a full rest. Yeah, adapt the load on the structure in a pain-free area. So we're doing the shockwave, get them in the pain-free area, and let them train whatever they can do without suffering from pain before the training, during the training, and after the training. So this is the normal rehab process we always try to maintain. So as you can see in the MRI check after 8 weeks, perfect consolidation of the situation. It's no wonder that we still see the fluid a bit in this area, because the MRI pictures take a lot longer until this is not seen anymore. But the player earned 1 ATP point 1 week after this MRI. All kinds of ligament ruptures. The German soccer player, first league, distortion trauma during the game. In the ultrasound, we can see the ATFL rupture, huge swelling already, joint capsule injury. So we did an acute treatment within the first hour with high power laser and cooling. And after 12 hours, as I mentioned, laser and shockwave together. And then cryotherapy afterwards again. After 24 hours, walking with full load is possible. No swelling anymore, no pain. Then we did the MRI on the next day, and we can see the rupture. But what you can see is that in the joint, there is almost no fluid left. So a very effective from the very beginning. This is basically how a treatment can look like. Yeah, you see, this is another player. You see the ankle, quite big swelling, and second and third picture already swelling is gone. So we concentrate with a smaller tip on the ruptured area, and the right picture is kind of cooling we are using for these injuries. So this player had a total downtime of 19 days. To show you how we can increase blood flow and decrease the swelling, the left pictures are before shockwave, after shockwave pictures. Yeah, this was a player coming with a secondary lymphatic edema. You can see in this area, it was just too tight. The decrease of swelling, the reduction of swelling through this area was almost not possible. So we opened this area up with a device, and then we drain the swelling out of the foot. And this is the result afterwards. On the right side, you can see we're using thermography devices to show the patients and just as a kind of documentation for us what is happening in the area. Yeah, about inflammation, increased blood flow. The left was a picture, this is an ACL rupture before the treatment with the shockwave. And this is the picture after shockwave. And you can see how the blood vessels are still activated, how they try to drain the knee. It's even more clear on this. It's another ACL rupture. This was before, and this is after. And you can see these. You can see it. You can see it after the treatment. Yeah, the reduction of swelling, and you can see how the blood vessels start to work. And quite interesting, the left picture here was done directly after 30 minutes of manual lymphatic drainage. This is how it looks like. Hot, the hot area is just all over the knee. And if we do the shockwave, you can see, of course, temperature is going down because of gel, but you can see how the blood vessels start to work. And this is a long-lasting effect. This was the same patient 3 days later, and we can still see the vessels are working. And this is after another shockwave. So this was first and second treatment when the patient first came to the clinic. Schlatter disease. Everybody woke up just because of the noise. Schlatter disease. I told you it's an apophysis, not a growing zone. I need to make sure not hitting the growing zone, which is located in this area. So in this 90-degree angle through to the tuberositas tibia, it's a perfect way to hit the Schlatter disease. These patients are very, very painful in the beginning because most of these boys and girls come just too late. Yeah, they try to wait and try to wait and try to wait until it's not really going there. Pain for 8 out of 10, this guy. So possible treatments, of course, just shockwave alone. If it's too painful, using the laser before and then shockwave, and after, of course, the cooling device. So after most of these patients, after total amount of 3 treatments, are pain-free and could start full training again. Bursitis capsulitis. This was one of my patients suffering from an elbow spur. So if you hear elbow spur, always have heel spur in your mind. Yeah, we're not shooting the spur away. We need the influence on the pain and the inflammation in this area to decrease the swelling, which starts to appear because of overuse. This overuse also generates the spur. The spur itself makes no problem in the tissue. So as long as pain and neurogenic inflammation are decreasing, the spur can stay where it is. And after 4 treatments, the elbow looked like this. No problems anymore. Yeah? So these 4 treatments were enough. No inflammation. He is a cyclist, so he can continue his cycling again. And the spur is still at its place without causing any problems. Frozen shoulder. These patients are suffering really a lot because it's a very limited way what we can do with these frozen shoulder patients. So this patient came October 17, starting with a shockwave immediately, just 1.5 bar pressure because it was just too painful. But already during this treatment, the improvement was clearly seen. A bit more range of motion, less pain, so we can increase the pain during the therapy, yeah, and a muscle relaxation effect, which is quite important because they always try to secure the shoulder and have a very strange habit in their shoulder. Cooling therapy again afterwards. Then 4 weeks later, so after 4 treatments, already 2.5 bar, even more improved pain. Sleep is very important because if these patients sleep on the shoulder, very painful, she was able to sleep again. Another 4 weeks, so after 8 treatments, up to 3 bar, and nearly 120 degrees of abduction. So everyday life without trouble. Yeah, of course it takes time. Yeah, but these patients improve so much during a treatment to take part in your daily life activities. More physio, more shockwave treatments every 4 weeks. And then just if time goes by, fully restored. Open wounds, about wound healing. This was under 19th player, very painful blister on the small toe, so a kind of tailor's toe. You can see the 5th toe is going to the inside. Blister was not infected, yeah, it was just swollen and very, very painful. We opened the wound to control if there's nothing infected inside, cleaned it, and started the shockwave immediately. A possibility to do the wound treatment can be like this. We use disinfection fluid directly on the skin, put around some plastic foil, and then using the gel. This is a very good way to apply these shockwaves on open wounds. The follow-up pictures, as you can see, day 1 to day to 1 week, it's perfect wound healing. Yeah, color is changing, so perfect healing. And the result after 12 days looked like this. But even more important is the second picture. I tried to show it by pressing the wound together. We have a very soft tissue. So now we can work on this tailor's toe, making a correction and a bit more abduction, putting something in between toe 4 and 5. So this is basically not just a wound treatment. In this case, it's also the possibility to change or the correct the direction of the toe. So think of all your hallux valgus patients. This is the way to treat. Sorry. Or even if wounds look like this. So this was just a soft tissue wound, no tendon issue in this case. This guy came 14 days after trauma because the wound starts to get inflamed in this area. It was still swollen. It was still not good in going into flexion and extension, and it was painful. So we have pain, neurogenic inflammation. We have got all these main things we need to treat or can treat with the shockwave. So if we check what is happening within 16 days with this knee, it looks like this. The end picture after 16 days, we have got no swelling, no pain, healed, soft scar tissue, maximum of flexibility in the knee, flexion and extension. After 16 days, after it seems that the wound is not healing, this patient can go already cycles and is running. Chronic polyarthritis, 16-year-old patient since 28 years using painkillers, several deformations on the hand, very painful. Definitely you need more than 3,000 to 5,000 impulses for this hand, 20 Hz frequency and cooling. I've got a nice follow-up, 3 follow-up pictures, 15 days with a total number of 5 treatments. What you can see is how the color, the swelling is changing during this 15 days of treatment. So these patients, you can't heal the chronic polyarthritis, but they don't need any painkillers. They have more range of motion in the, and mobility in the fingers. This woman, the most improvement was that she can use her hands for putting cream into her face. Yeah. So every 4 to 6 weeks, depending on the patients, they come back and asking for another shockwave to improve or maintain the situation in these hands. Low back pain. Like all the other indications where we're using shockwave on the spots where we have the pain or the injury, the same as with the low back pain. This study shows that even with unspecific low back pain, it's a safe and effective treatment. I have no real case about the low back pain. I just have something about the treatment of cervical spine, 1 treatment per week. The trigger points in the cervical area are always just 1 bar for the cervical spine because it's a very sensitive area. Then they are very quick, pain-free after 2 or 3 treatments. And the lumbar spine syndrome is exactly the same. But I want to show you now, before at the end, before we come to the questions, I want to show you what can be treated also without being on the spot where the real issue is, because sometimes it's needed because your patients are too painful or you just can't reach this area. And a perfect way to show what the device is able is by talking about low back pain. So the tendinopathy of iliopsoas muscle. We are, as I mentioned in the very beginning, we are not allowed to shoot in the abdominal region because of gut and intestines and the airflow tissue. So it is hard to reach the iliopsoas muscle itself. I can try to reach it a bit from the lower back, but it's not working really nice. I can reach the tendon. This is not the problem, but to get an effect on the psoas muscle itself is hardly impossible. And the psoas muscle is one of the most important muscles for all kinds of low back pain. So we always come back to the psoas muscle. So how can we affect the psoas muscle? By using the shockwave. to strengthen psoas muscle, we put our patient on the belly, treating from right SI joint to left SI joint, over the glutes to the trochanteric region. By doing so, we can improve strength immediately. Second, low back pain. This was a patient, a player of mine, suffering from low back pain for a very long time. We treated the local area. We treated the hamstrings, manual techniques on upper back, lower back, cervical spine, not working, not long lasting. So changing food, checking the nose, teeth, no effect. By doing an EMG measurement, we could see that the left biceps femoris muscle was always active. We couldn't reduce this by just shooting directly on this area. But a very successful thing to get an influence on the kinetic chain downwards to the lower back is treating trapezius muscle, whole region. That's what we did basically, and did the retest of EMG directly afterwards. What you can see, the effect which we didn't have by doing manual techniques in the upper spine, we could generate the effect in the whole kinetic chain downwards to the lower back and hamstrings. So the hyperactivity of the left biceps femoris, of the biceps femoris muscle stopped immediately. But one of my most effective and important ways to treat low back pain, hip rotation, especially extra rotation problems, and pain situations in the area, is this. The patients, basically, it doesn't matter if it's like him, and a young ice hockey goalkeeper suffering from low back pain, IT band pain, hamstring pain, referring pain, extra rotation deficit, yeah, but also all our low back pain patients. So you can see extra rotation on the left is worse than on the right. Very painful in the area, unspecific, yeah, not a certain spot, but the whole area. Pain score 7 out of 10. What I always do with these patients is on the back, sitting, standing, depending on your patients you have in your clinic, I go beneath the malleolus medialis, and where I can find the flexor tibialis posterior muscle chain tendon. And by shooting 2,500 to 3,000 impulses at 20 Hz frequency, pain threshold of the patient in this area, I can affect the whole kinetic chain from the tibialis posterior tendon via biceps, adductors, and finally reaching iliopsoas. And the effect is going even a bit more upwards. This will be part of a professional, probably live treatment series we do. But treating this, the effect immediately afterwards is this. Same rotation, almost improvement of rotation, and decrease of pain. So more range of motion, but less pain than in the beginning. And then when we did this, these patients can tell us specific places where the pain is left. Then I concentrate on this pain. And most of these patients walk out of the clinic almost pain-free after just one treatment. Try it out. Enjoy doing this. Come back for questions whenever they appear. A really important point at the very end for me is network. I'm just doing the network thing, a lot of guys doing this. So you see the German team in the left, but the network team is spread around all over the world. We try to be connected as good as we can. Don't hesitate to write emails or whatever if you have questions, or for me, if you found something out which I want to try, or if I should see, because the kinetic chain treatments are just in the very beginning. So there are many, many things to find out in the future. So enjoy doing this, try to find out things, and not just keep them for you, share them. And then you can find a lot of nice people around, not just athletes or people all over the world, and share the knowledge and stay in touch and make visits. So it's quite important. Get your practice certified to stay in touch with EMS on the website. Get more information, access to all the videos, to all the studies which are on the database. Get certified to that your practice can be found on the global map, that your patients basically find your clinic. So let's stay in touch. Let's continue the networking, what we already started. And always remember, we need pain. We need to suffer pain if we want proper healing. So we come to the question and answer part now. For this, I will just stop the sharing and then go on the question and answer button, and then let's see what we have for questions today. I tried to answer them all. We have some more minutes to go. Can you combine shockwave with photobiomodulation or hyperbaric oxygen therapy? I must say I don't know anything about photobiomodulation, but hyperbaric CO2 therapy is basically something we do. This is we have got a special cooling device, and this is what we definitely combine to accelerate the healing. So I try to get information about photobiomodulation, or you can provide me, and then we try to find this out. Hi, Derek. Do you require specific training course to be able to use shockwave machine? Basically, you don't need a specific training. When you purchase one of these devices, and it will be delivered, probably you get an introduction by the guy who is delivering the device. Otherwise, it is a very simple way. So just two plugs, yeah, for the device, one for handpiece in the device, and the voltage cable, yeah, which basically needs you need, and then just stick on the protocols or on the basic protocol I just mentioned, and you can start doing using the machine immediately. Yeah, can have a look at the videos which can be found on the EMS website or on the YouTube channel of EMS. And then it shouldn't be a problem. If you still have any problems, don't hesitate to contact me or the guys from EMS. They will help you. Alberto is asking about intensity of cervical myofascial problems, for example, contracted or stiff trapezius or paravertebral muscle. So cervical paravertebral muscle area for relaxing, I try to stay beneath the pain threshold. So I'm about between 1 and 2 bar pressure. 1.5 is a good intensity to use. Always stay in communication with your patients, yeah, if they feel weird sensations or feeling uncomfortable. This is one of the most things happening in the cervical spine, that the patients feel uncomfortable. So 1.5 bar. When you go deeper, trapezius muscle, this area, for example, or even lower, pain threshold. Then we're working on the patient's pain threshold again. Yes, use the big applicator, because then we have not the concentrated area with the pain, so it's easier to treat a larger area here. You try to become an expert very early. So can it also be treated at a diaphragmatic level in the costal insertions? Um, in the back, yes. In the front, it needs a lot of experience to don't reach the lung tissue in this area. So my suggestion is leave the diaphragmatic area in the front. In the back, yes, you can do it. Do you suggest using therapeutic ultrasound after applying shockwave therapy for trigger points? You can basically use them. I don't use them. I prefer using the cooling device to get more and better effect. Basically, it's not a mistake doing this. My personal experience is um, not using ultrasound, use the cooling device. You're welcome, Derek. Good textbooks or websites for further education and learning. There are no good books about shockwave therapy. Spare your money for books about shockwave therapy. There is one book available on the market, which has been done from another device distributor or manufacturer, basically. But in this book, they are talking about things what they actually can't provide. So no, there are no books. Stay connected on the internet. Use EMS website, YouTube channels, and you get the most important things, what you need to know. And if you have questions about what to treat and how to treat, try to get in touch. Instagram, Facebook, WhatsApp, email. There are so many things. Yeah. If you have got any different time zones, so don't be angry if I'm not answering soon or within 2 hours. Yeah, but you will get an answer. Do you have any information treating dogs? No, not so far. I have a dog. I never tried it before. I know that there are a lot of things and informations about treating horses. We know that treating horses is perfect. Dogs, there is depending on the dogs, there can be one difficulty because if they have a lot of hair, it can be difficult to get the wave and ultrasound gel and get the wave into the tissue. With horses with short hair, it's more easy. Yeah, give it a try. If you have a nice dog, you can use it. Same indications and contraindications, basically. Especially clinical guidelines and protocol. Again, the question about protocols. There is just one protocol, and this protocol is basically for all the indications. 20 to 25 hertz frequency, 3 to 5,000 impulses, pressure, pains, individual threshold. This is basically what we need. A lot of energy in the tissue. We need the pain feeling to get the release of substance P and get down the neurogenic inflammation and start the healing process. So there are no specific clinical guidelines and protocols. It's just this protocol. Yeah, trigger points 1 bar, cervical spine 1.5 bar approximately, so a bit lower of the pain threshold, and then that's it. Question about scar tissue. Um, it's about scar tissue. Do you always have to use the plastic foil to go around? Basically, it's all about wound management, which is basic stuff. When I have stitches inside, I not always use the plastic foil, of course, because I'm using ultrasound gel. You can use sterile ultrasound gel, yeah. Doing the shockwave, because it's just a short and quick treatment and so has no really bad effect on the wound. Clean it, disinfect it, and make proper wound management. Yeah. So this is my personal experience and the personal way I'm doing this. Yeah. Otherwise, you should use the plastic foil, but I do it both ways. Yes, it's possible to see the webinar again. The link will be provided, and you can have a look at the webinar. It's recorded. No, the shockwave's not heating up metal implants. You don't have to worry, no screws, etc., because it's completely different than ultrasound therapy. Yeah, this is contraindicated. Yeah, you're right in this case, but the shockwave is not overheating. And it's not loosening any metal, so hip replacement, knee replacements, perfect. I try to find two more questions because we already at the time. All the other questions which I can't answer now can be just you can just tell me after per mail or send them to EMS. That is basically no problem. Can the temporal mandibular joint also be treated? Yes. About the height we can go is TMG. Oops, TMG. We're not going higher. And the occipital region for trigger point treatment. So 1 bar pressure, 300 to 400 impulses or 300 impulses on a trigger point. Occipital region, perfect. Mandibular joint, sometimes it can be necessary to use earphones because the sensation and the acoustic noise for the patient is uncomfortable. So I'm using earphones, but yes, you can treat the TMG. Shockwave can't be used for stroke. What frequency do you suggest using for treating plantar fasciitis? 20 to 25 Hertz frequency, always. This is the frequency we treat. So, amazing. So many good questions. I hope I made the most important things clear for you. And don't be disappointed that I didn't answer all the questions. There are many more. We have these questions and we try to come back with these questions. Otherwise, please just write me Instagram, WhatsApp, email, whatever. Contact details will be available in your local distributors or EMS. So I hope you had a wonderful lecture. It was enjoyable for me. We try to continue these, and I hope we're gonna meet or see us in real life. Otherwise, take care, enjoy your evening, and yeah, bye. Thank you.